And local hospitals in the area of the water main break are stuck. They've got to cope without water too.
A lot of things that they have to handle. Dr. McGeorge is live at Providence Park Hospital in Novi right now. And Doc, obviously they're prepared for things like this, but this is a huge undertaking.
Oh, no doubt about it. But you know, Karen, hospitals play an important role during a community emergency like this, and they are up to the challenge. Here at Providence Park in Novi, the response was swift and definitive, aimed at keeping patients safe.
At about 9 o'clock last night, by the city, that there was a water main break that we were affected by and that we would be on a boil water alert. We have our emergency preparedness group, and we pulled that group together.
For Providence Hospital COO Margaret Klobuchar, it's been a long day. Hospitals across the affected area reacted similarly, providing for the immediate need.
That means we have a supply of bottled water and gallon jugs of water that we are able to put into operation so that we can continue to take care of patients very safely.
Large hospitals like Providence Park in Novi and Henry Ford West Bloomfield also changed emergency room protocols.
We've closed the emergency room for ambulance traffic. We're of course still taking any walk-in patients that would come in.
For Henry Ford Health System COO Bob Riney, there were also considerations regarding multiple outpatient locations.
So we've had to close a number of our ambulatory sites today in the local marketplace.
Patients of large Henry Ford outpatient facilities like the one on Farmington Road and the Columbus Medical Center received calls to reschedule appointments. As for hospital patients, Providence Park in Novi transferred 4 inpatient dialysis patients to Providence Hospital in Southfield. Meanwhile, at Henry Ford West Bloomfield,
we made a decision just to err on the ultimate side of safety and transfer our most critically ill patients. So we transferred about 15 patients to Henry Ford Hospital in Detroit.
Now, the bottom line here is the hospitals are open and they're caring for walk-in emergency patients, but if you have any elective outpatient procedures or appointments and you did not receive a call to reschedule them, you should call to check the scheduling arrangements. Back to you.
Now, Doc, I know you learned a lot about dealing with water concerns when you went to Haiti and reported from there. Is there anything people here can do at home in terms of filtering the water?
Yeah, you know, that's a really important thing. Filtering any water and making it safe to drink is really easy. So rather than worrying about having gallons of water on hand or worrying about buying water, just having something like this filtration straw or this simple filtration bottle can be used to make water immediately drinkable. And these can be found online or at any outdoor stores. They're really handy for an emergency department or an emergency like this, and I highly recommend them.
All right, quick and inexpensive solution there. Thank you very much, Doc.